New Dimension Adult Foster Care Program, managed by Aftercare Services, Inc., located at 2 Lexington Street, Suite 1, East Boston, Massachusetts. Adult Foster Care is a program sponsored by the Massachusetts Department of Health, which combines daily assistance with personal care, case management, and medical monitoring services with oversight by New Dimension Adult Foster Care in the caregiver's home.
Part of your responsibilities as a caregiver in the AFC program is to provide assistance with what we call activities of daily living. In this video, we are showing the caregiver assisting the client with ambulation. This would be coded as a 3 on the activities of daily living flow sheet. The client is not able to independently ambulate by herself or transfer at the dining room chair. It is the caregiver's responsibility to make sure that the client ambulates with the appropriate assistive devices, which in this case is a cane. Another activity of daily living is eating and meal prep. The caregiver in this scene is assisting the client with the appropriate meal. The meal must be nutritious and ordered by a physician. It has to be the appropriate consistency so that the client can consume the meal safely without choking. The caregiver is seated by the client and monitoring her as she consumes the meal safely to make sure that she eats the right amount of food and also eats it safely without any potential for choking. Another activity of daily living is med administration. And in this scene in the video, the caregiver is making sure that the client is consuming the medications. The client must consume the correct medication at the correct time at the correct dose, and this is ordered by the physician. It is the caregiver's responsibility to ensure that the client takes the medications as ordered by the doctor. This will promote health and prevent exacerbation of the disease process. The client has safely consumed the medications and her meal, and at this time is just seated at the table. The caregiver is now preparing to assist the client with transferring. Transferring is involved by assisting the client to a standing position with her assistive device, which is the cane. As you can see, the client is not able to independently do this herself, so this would be coded as a 3 on the flow sheet of the ADL log. The client also requires assistance with ambulation to the chair and transfer onto the chair. Here in this scene, the client is applying some makeup and lipstick. The client is also going to comb her hair at some point in the video. This is considered grooming on the ADL flow sheet. This is the caregiver is providing physical assistance with grooming, and this would be coded as a 3. As you can see, the client is doing some of her own hair. We want to encourage the client to do as much as possible for themselves so that they will feel independent. It promotes a positive self-image, and also the client feels safe and secure that the caregiver is there to assist them with whatever they need at that time. The caregiver at this time is assisting the client with dressing. Application of socks is a portion of dressing. But at this time, it is also important for the caregiver to note the client's feet and the condition of their feet. Particularly clients who are diabetic or have circulatory issues will sometimes have open areas or sores on their feet or maybe at the bottom of their feet. It is the caregiver's responsibility to make sure that she has adequately checked those feet for any open areas. Clients who have circulatory issues or diabetes may not even feel the fact that they have an open area on the bottom of their foot, and the caregiver is ultimately responsible for inspection of the client's body and notifying the AFC nurse and physician of any changes in the client's feet. It's also important to check for swelling or any other changes in skin color that might indicate diabetes starting if the client isn't already a diabetic, or maybe fluid retention. In this scene, the caregiver is assisting the client with dressing. She's helping her put on her jacket, which would be coded as a 3 on the ADL flow sheet. The caregiver is also responsible for making sure that the client wears the appropriate clothing according to the weather. Some clients are able to make that decision on their own and others are not. The caregiver is ultimately responsible. Here, as she's zipping up the jacket, you can see she's providing physical, hands-on assistance with dressing, and that is coded as a 3 on the ADL flow sheet. The caregiver is now assisting the client with ambulation. She is not able to safely ambulate by herself, so this is also coded as a 3 on the ADL flow sheet. Caregivers are also responsible for assisting clients with toileting, positioning in the bed, and incontinence care if it applies to the client.
Who is eligible for adult foster care? The criteria is any adult 18 years or older who can live in a regular household setting and their medical condition does not require the highest level of care. They need to have a medical condition or physical or emotional condition that requires some type of physical assistance. They need to be oriented to time, person, and place, and not a danger to themselves or others in the home. They have to be unable to live independently, require minimal supervision and or assistance in completing one or more of the following areas: dressing, personal hygiene, transportation, ambulation, nutrition, or health supervision. They need to be capable of taking action for self-preservation in case of fire or storm with direction. Client and caregiver must live in the same household, and the client must have Mass Health standard coverage. Who can be a caregiver? The caregiver must be 18 years of age or older who meet the health criteria to be in charge of another adult. They can be a relative or a friend, but not a parent or legally married to the client. They can be one who is knowledgeable and can provide care to the client in a professional and caring manner in a safe and healthy environment. Regardless of how you became a caregiver, you are about to take a new role for which you may not feel prepared. It is normal for you to feel nervous or overwhelmed about this experience and what is expected of you. You may experience a number of mixed emotions, including anxiety, anger, and sadness. At the same time, you will probably feel the desire to care for your loved one the best you can. The role of a caregiver is to provide assistance with activities of daily living. These are called ADLs and ADLSs and IADLSs. Examples of activities of daily living include dressing, bathing, eating, brushing teeth or combing hair, and positioning in a bed or a chair. This includes personal care, emotional support, medical care, household management, translation services in medical settings, coordination of clients' transportation needs if unable to drive, such as the RIDE, the BAT, or MBTA, execute activities in the care plan, report any treating or non-treating changes in client's behavior to case manager or nurse, respect client cultural sensitivity and beliefs, respect client's privacy, maintain up-to-date CPR and first aid certificates, complete monthly logs, must have in records an alternative caregiver for emergency coverage. Caregiver will benefit from 14 days vacation after a year in the program, but the client and caregiver need to make arrangements for coverage. In order to become a caregiver, one must meet the following criteria. There needs to be a pre-admission evaluation, a comprehensive assessment, a matching meeting with 2 visits with the client, preferably caregiver to be a relative or friend, physician clearance, financial eligibility, such as the caregiver has to have another source of income, they must be 18 years of age or older, must not abuse alcohol or drugs, a mandatory urine screening, cannot be a parent or spouse of the client as defined in 130 CMR 408.402 Massachusetts regulations, must be willing to complete a daily care log and send it monthly, coordinate transportation for client appointments, pass a Cori check, arrange medical appointments, acknowledgement of universal precautions. CPR and first aid certificates and adult foster care training are also required. Which situation must the caregiver notify the AFC provider? AFC providers must be notified when there is a death of a member, a medical emergency or significant change in status, a fire, accident or injury, contraction of a communicable disease, notify of non-urgent or non-emergency changes, any expected departure from residence by a member or caregiver, and when there is an alternative caregiver. Also, maintenance of the qualified setting consistent with requirements of 130 CMR 408.435 Massachusetts regulations. When and how clients lose eligibility. A client will lose eligibility in the program when the client no longer meets criteria for participation in the program, and that is when a death occurs, when the client requires a higher level of care, when the client poses behavioral issues in danger to others, when a client needs cannot be met by an AFC provider, or when client's health status improves and the person becomes independent. At this point, I would like to discuss some universal precautions involving your client. Universal precautions isolate the caregiver from contact with fluids which may contain HIV and other blood-borne pathogens. The risk of transmission can be minimized if caregivers use the following guidelines. Number 1, extraordinary care must be taken to avoid accidental wounds from sharp instruments contaminated with potentially infectious material and to avoid contact of open skin lesions with that material. Number 2, gloves must be worn when handling blood-soiled items, bodily fluids, excretions and secretions, as well as surfaces, materials, and objects exposed to them. Number 3, hands must be washed after treating any patients with bodily fluids, blood secretions, or excretion problems. Hands must be washed thoroughly and immediately if they become contaminated with blood. All blood spills, bodily secretions, and excretion must be cleaned up promptly with a disinfectant solution such as sodium chloride, 1 to 10 dilution of household bleach with tap water.